Surgeons are highly trained professionals, trusted with people's lives every day. But even the best doctors are human. A fascinating study published in the BMJ took a closer look at how non-medical life events, specifically a surgeon's own birthday, might affect patient outcomes. This wasn't just a small observational report. Researchers analyzed data from nearly 1 million emergency surgeries performed in the U.S. between 2011 and 2014, involving over 47,000 surgeons and Medicare patients aged 65 to 99. So what did they find? Patients who had emergency surgery on their surgeon's birthday were more likely to die within 30 days than those who had surgery on any other day. Here's the data. On the surgeon's birthday, the 30-day mortality rate was 7.0%. On other days, it was 5.6%. After adjusting for patient characteristics and comparing the same surgeon on different days, the mortality difference was still significant, 6.9% versus 5.6%. That's a 23% relative increase in the risk of death, simply based on the surgery falling on the surgeon's birthday. Now, this isn't about bad doctors or poor skills. The researchers believe it's about distraction. On your birthday, your mind may not be fully at work. You might be thinking about evening plans, texts from friends or family gatherings. You might feel rushed or preoccupied. These are human reactions, but they can have real consequences in a high-stakes environment like the operating room. The study's authors suggest several ways a birthday might subtly impair performance: feeling time pressure to finish early, distractions from birthday greetings, messages, or conversations, allowing trainees more responsibility to free up time, unconsciously using mental shortcuts or intuitive decisions rather than careful analysis. Interestingly, the study found that surgeons didn't operate less often on their birthday. In fact, many chose to work that day. But even when comparing the same surgeon on their birthday versus other days, the outcomes were consistently worse on the birthday. So what does this mean? First, it shows that seemingly minor personal factors can affect professional performance, even in critical fields like surgery. Second, it raises important questions about how to reduce distraction and support better decision-making, especially on days when personal events might affect focus. And finally, it reminds us that health systems can use big data to uncover unexpected patterns and improve patient care. In the end, the study doesn't say surgeons shouldn't work on their birthdays, but it does suggest that healthcare teams might consider additional checks or support on such days, especially when lives are on the line.